What's going on, my friends? Thanks for joining me again. This is your first time here. Welcome to my channel. My name is James, and I talk a little bit about everything. But today I'm going to continue on my video series about dental implant surgery. So today marked my 1-month follow-up visit with Innovative Dental in Springfield, Missouri, with Dr. Grant Olson, who we also like to call Dr. O. So whether he likes it or not, we got to celebrate our 1-month anniversary together. So thanks, Dr. O. But I learned a lot today. Dr. O took me to school and brought some things to my mind that, quite honestly, I hadn't thought about and how it affected my recovery. So if you're interested to learn more, stick around and find out. Well, good choice. I'm glad you stuck around. So, as I mentioned, today was my 1-month follow-up. So we had an 8 o'clock appointment. I drove down there and I actually filmed several little snippets of video on my way down where I thought I was talking to the camera. Well, actually, I was talking to the camera, but the camera wasn't listening because there was no audio. So we had to scrub that. Maybe I'll throw that in the end for a blooper reel and kind of start over from scratch right here. So at the end of the day, today was that follow-up visit. I got there at 8 o'clock, and as normal, I'm going to tell you what, there was a lot of people there. I was probably the first one in the parking lot, maybe second. By the time I got inside and 8 o'clock hit, there was probably at least 15 to 20 people in that lobby waiting on their appointments with Dr. O or some of his colleagues, because they do perform many procedures there of different varieties. So I can't even speculate what they all are. But at the end of the day, 8 o'clock came. They brought me straight to the 3D scanner where they did a 3D x-ray, 360 degrees, and then proceeded to take me to a room where we could actually look at those images and see what was going on. And, luckily, and as I expected and hoped to, I'm healing great. They said they couldn't find anything that caused any concerns, and they thought everything was going well. I did have some concerns, and I brought that up to his one of his team members' attention, who, let me just tell you, everyone on his team is fantastic. I mean, I haven't met one person that hasn't been friendly. So keep that in mind when you're picking, you're going to your dentist, you're going inside, you're looking at people. Do they enjoy their job? Do they like what they're doing? Do they seem happy? Because I've never seen anybody that didn't seem like they enjoyed themselves at Dr. O's office. But back to the story. Squirrel. Back to the story. So we were looking at the images. Everything looked fine. I brought that I had 3 primary issues that I wanted to get addressed, or at least talk about. First one was that on my lower temporary here, when I was in Chicago 2 weeks ago, out of the blue, a line, like a little rigid line, vertical line, was running on this lower temporary, and it came out of the blue. It wasn't there before because your tongue would have told you. But after further inspection, looking at it, I was concerned when I was in Chicago that I had either fractured it or cracked that lower temporary. So I've been very careful and very ginger with it over the past week or two. Thankfully, that's not the case. It was just some kind of buildup, either the filler that goes on top of the little cap, or some kind of something from something I ate. I don't know. I know I scrubbed it endlessly with a toothbrush and it didn't come off. You could pick at it with a fingernail and feel it. But they went in, they took a polisher, polished it down some. I was very specific. I didn't want them to take the material off because I was concerned that we were introducing a point of failure if we do that. Because if we take material out of that little spot, then the constant pressure on those teeth could cause that to fail right where that spot was. Second thing was on my lower section of my mouth. On the lower section of my mouth, there was a little tissue buildup. So there's a little tissue buildup between my tongue and the back of the prosthetic. And it's not as big as it was previously. It does seem like it's going down as I continue to heal. And hopefully in the near future, it will, diminish even further, or at least slip up underneath the prosthetic. We don't know. The assistant there at the office said, "Hey, you're still healing. Don't focus on this. These things happen. It's common. So you just got to give it time, see how your body reacts, and let it go for what it is." Second one was in the upper section of my mouth, so where the prosthetic hits the roof of my mouth. And this is the one that was really unique to me. And this is where Dr. O really, made me sit back and think of what was going on. So I have these two little spots, these two little, I forget what he calls them. I'll see if I can look it up and I'll stick it in here afterwards while I'm editing the video. But he says everybody has them. Everybody has these couple little bumps here and there in their mouth. And he says what is unique is that, your mouth is basically a map, right? And your tongue is kind of the navigator on it. It knows where every little nook, cranny, bump, scratch, scar, whatever is there, your tongue knows where it's at. And when you have a procedure such as this and you do some altering where, you've tightened up maybe a little of things or, because they've got to stitch you up so things move just a little bit. Your tongue needs to relearn your mouth. And for me to be all, up in arms and worried about this at this point in time is senseless. And the more I thought about it and thought about it and I thought about it, I was like, I'm an idiot. I'm an absolute idiot. If I go back and think prior to this procedure, for the last, 7 years maybe, I've had a front partial that contained, I think, about 10 teeth. If I remember correctly, because I had 17 pulled, somewhere in there. And I had what they called a flexi. So it was a flexible partial. And on that flexible partial, it's got a little area that concaves up and goes over the roof of your mouth. Now, here's an example. I don't have it here. It's inside the house and I'm out in my shop. As you can see, it's a different background behind me. I've got workbenches over here my son uses for his painting and model airbrushing. Then we have the 3D printers in the far back wall and my son's desk over there. And we're got the inauguration going on over there. So different background than normal. So excuse me if it's messy. I know it needs to be cleaned up. And that's actually what my goal is as soon as I finish this video. But if I pull out an old partial I had, this is really, really old, and I just had it sitting out here, you can see that, these areas here that go up. So when that's inserted into your mouth, you're seeing these teeth and you have this gum line here. Well, your new ones are stopping, right in here, and you don't have this big old nasty hunk of crappy metal or plastic or whatever you might have today. My flexi was, flexible plastic material. Well, that actually would have covered up these couple spots that I'm talking about. So over the last 5 or 6, 7 years, however long it's been, they're out of mind. My mouth, my tongue doesn't even know they're there anymore because they're covered. Now, that could cause irritation too when it's constantly rubbing those bumps. And that's probably why I had a lot of irritation in my upper roof over those years. It just never crossed my mind and I never had it checked out. I just dealt with it. But with that section of that partial now being gone, those bumps are exposed and they're trying to learn its course of where they belong because of the procedure. And my tongue's trying to understand what they are now. They just happen to be in a goofy spot that mounts, that butts right up against where the prosthetic is. And, over a period of time, they can still continue to dissipate and maybe even diminish, much like the bottom. Or I just map my mouth and understand that they're there and they are what they are. There's nothing I can really do about them. Or the third potential, and no one told me this, but I'm thinking this. So this is not medical advice. This is James's thoughts. And those can be dangerous, so be careful. Is that in 6 months when I go back, so in 6 months I go back to have my impressions made or the scanned. It's not those messy stick your mouth impressions. They actually 3D scan the inside of your mouth for your final teeth, your final set of your upper and lowers. And as I mentioned before, I'm getting the zirconium, so I'm going with the top of the line that they offer today. At that time, in 6 months, I go back in. They're going to have to numb my mouth, right? They're going to numb me all up. And then they're actually going to take these temporaries out so they can perform that scan. I'm hoping, and like I said, pipe dreams here. I'm hoping that when they take those out, and by the time they put these back in when they're done scanning, that maybe that little bit of tissue on the bottom kind of settles down and goes underneath. And same with those two little bumps at the top, that they will kind of just nudge down, we're talking just tiny bit, and sit up underneath the prosthetic where you have that little bitty space in between the actual implant and the prosthetic. So that's my ideal situation, and I hope that's what happens, but we won't know that for until June. So hang out, come back and visit in June if you want to know how that works out. But so that was good news. That's something I hadn't thought about. And I appreciate Dr. O being just upfront with me. And, I don't know. I kind of felt maybe he wasn't the most happy with me. So I don't know if he watches these videos. But if you do, Dr. O, hi, how you doing? And I've never said anything bad about you. So don't be upset with me. I'm being serious. He seemed a little bit offstandish today, but we're going to let it be because it's Monday, right? And it's cold. It was 1 degree outside, and I wouldn't want to be working either or having to do with stuff. Maybe he had a patient upstairs that he was getting numbed up, and maybe that wasn't going well. Then he had to come see me. So it could be numerous things. Maybe he has nothing against me, and maybe he's never even seen one of these videos, and that's okay too. But what he did mention to me when I was talking about my healing, this is why I think he's seen a couple of them, is that I've struggled with my healing. Where we see all these people who heal in 2 or 3 days and they're fabulous and smiling ear to ear. Well, that's not my case. I was in pain for about 3 weeks. What he mentioned to me was, obviously what I've said. Not all people heal the same. We know that. Not everybody's built the same. Not everybody's chemical makeup, the vitamins, and so on and so forth are the same. We understand that. It's not rocket science. But what he said that I didn't think about was that up until this point, I had been a smoker. So smoking affects, obviously the blood flow in your body and your ability to clot properly or even, heal as it pushes through your body. And he says, it doesn't matter if you quit smoking for the procedure or if you quit smoking since the procedure. The problem is that the damage has already been done and there's no way to recover from that. So you have to be cognizant. If you're a smoker and you're considering this procedure, try and stop as soon as you can. Stop well in advance of your procedure and give yourself a chance if there is a chance. Make sure you're taking your multivitamins. Make sure that you're getting your mouth cleaned out. Make sure you're doing everything that you can do. Those vitamins are essential in your recovery. They set you up for success. They give you a bottle of multivitamins, a probiotic, a rinse, spray, all these things to set you up for success. And I followed that regimen to a T. I never considered the smoking part. And I smoked up until the point I pulled into his parking lot to have my procedure done. So, like I said, my healing not properly has nothing to do with Innovative Dental or Dr. O. It's all me. And I've said that since day one. It has nothing to do with what they did. I never considered that. That's the first time he said that to me as well. And it makes total sense. He also mentioned that, maybe if you're a diabetic, you could, have a harder time healing. And, the one that really, the third thing that he told me that kind of made me, take a moment and pause and think was, he says, if you're vitamin D deficient, you have a higher chance of your implant not taken. So if you have implants installed and you have a deficiency of vitamin D, there's a good opportunity that your implants will fail. I've never seen or heard or anything about that. I'm not vitamin D deficient, but I'm absolutely going to be more cognizant to make sure I'm getting enough vitamin D now to make sure that these don't fail in the future. So keep that in mind too. If you've already had this procedure done recently, I know there's a few of you watching that have, make sure you're getting that vitamin D and getting those multivitamins in your body. Take care of yourself. Just because we had the procedure done doesn't mean we're out of the woods. We've got to continue to take care of our body to make sure that these things stay in our body. So I found that very interesting and thought I would share that information. But at the end of the day, everything's going well. I'm excited about the opportunities that this is going to afford me down the road. I can't wait to get those scans done, the try-ins made, because at that 6-month mark when they do the scan, they're going to print you a set of try-ins. And at that point in time, that allows you to customize your look and your smile. If you want to be one of those people that want to have that perfectly straight line that runs across that looks so unnatural and says, look at me, I had teeth put in my mouth. Hey, that's your opportunity to do that. If you want to have a little more of a natural look, adjust your canines or the way, maybe my top's just a little bit longer, that's your opportunity. And of course, your color of your teeth. Those are my words of wisdom for the day. So anyways, I hope everybody enjoyed this quick 15-minute video. Well, 15 minutes isn't quick. And the average person only watches about 3 minutes. So hopefully you got to this point. If you did, give me a like, subscribe, put some notes down there, comments. We'd love to hear from everybody.